All right. So you bump your head. What is the first thing the doctor checks? Shout it out if you think you know. Your eyes, exactly. What we found whenever we started this company was it's one of the most underutilized biomarkers in industry today. And for physicians utilizing this methodology and shining a pen light in your eye, they're only about 50% accurate in binning you into the appropriate metric, which would be on a scale of 1 to 3, and determining the sluggishness of the pupillary response. And this is a method that they use to directly diagnose you on whether or not you sustain any sort of head trauma or neurological disorder. So we are Brightlamp. We are a computer vision and machine learning company. We're bred out of Purdue University, and I'm going to talk to you a little bit about the products that we've developed. We've been featured in Observer, Big Ten Network, and TechCrunch. We are TechCrunch Disrupt alumni. So I'm sure Jason's very excited about all of that. So I pitched on the very big stage in front of all those people, just like in Silicon Valley. So Reflex. Reflex is the product that we developed. It is an innovative tool for physicians to be able to utilize and acquire the pupillary light reflex, which is exactly what those physicians are utilizing to make that diagnosis. It's a rapid 5-second test. We actually give the capability for a physician to alter the test time. It is the first algorithm to be utilized in the RGB spectrum. Right now they use infrared light and infrared cameras for very expensive systems, upwards of $9,000, in order to acquire the same information, and we thought that we could create a better way. And then it has pretty high accuracy. It boasts about 0.75 millimeters in average error. If you look at standard FDA-approved devices today, they have 1 millimeter in error. So our system, without having any sort of fixed distance from the face, has a better accuracy and error rate than systems that are deployed today in hospitals. We've identified quite a few use cases for this technology. We're working on our first two, which is alcohol and concussion, along with the base form of the technology to be able to just acquire the information for physician use, and we'll talk a little bit about those in a minute. Part of the advantage of why we're so important is we got issued our patent, number 1034605. And it is a seminal patent for the use of this technology for cognitive analysis, period, on a mobile device. So we have freedom to operate. It requires no additional hardware. So all you need is an iPhone that has a flash that works and a camera that works. And it's rather robust against environmental changes. We've tested it in ambient lighting conditions in all sorts of different ways and methods, and it works just fine. So these are a few of the advantages. It is the most rapid test time for acquiring concussion information, period. So the market, whenever we think of concussions, now the number of concussions that are being diagnosed is trending up, but the number of events that cause concussion is actually trending down. So you ask yourself, why is that occurring? Well, we're getting better at targeting them, yet only 84% of concussions go undiagnosed. So that means only 16% are diagnosed, which means that we still have a lot of room to grow with this $5.4 billion total market for this industry. But we're targeting the $750 million market that relates to the athletic trainers, athletic physicians, et cetera. So this is Reflex. This is what it looks like. It starts at $40 a month or $400 a year for a single user. We do have an enterprise model that we'll be launching here soon. I am proud to say today that we are in revenue. I just looked, so it's very exciting stuff. We're moving forward. We did a soft launch November 13th, but we're gearing up for our full launch next week. We have a few conferences planned, and we're getting ready to make a huge splash. Couldn't do this without all my awesome team members. I'm a biotech innovator myself. I have degrees in chemical engineering and chemistry at Purdue University. Me and Michael Himes, he is my co-founder, started this while we were there in attendance. And then we have Ramya, who's my computer vision developer, and a full commercialization team. And we also have physicians on our board of directors, and then the former CTO of WebMD and AOL. He is one of our advisors as well. So to close things out, what's up next for us is we're going to be conducting our full launch of Reflex next week. We want to grow our sales channel by 10x. Even though we got issued the patent, we are working on additional methods to protect our technology and then expand that scope outside of what Reflex is, and then take and grasp the concussion markets, the alcohol markets, et cetera. and then close our seed round of funding. Thank you. You go ahead, sir. That's the full concussion market. So what we see there is athletic trainers, sports medicine physicians, neurologists, et cetera. Athletic trainers are the first responders usually, and they usually have a sports medicine physician. That's a relatively new field, but it's typically a GP that's focused in athletics, and then they get like put and funneled down the line to eventually a neurologist. So that encompasses that market. There's 3.8 million concussions that are occurring every single year, estimated by the CDC. So it is a very large market. Are you more important, or is this guy more important?
I have 2 questions.
All right, Jason, we'll do one from you.
All right. Well, I have 2 questions. That's
one
not how this
now,
works.
one
Okay.
later.
That worked. Deal. Where do you use Python in your stack?
So our entire system, we use Lambda functions to conduct the analysis of the videos. So videos get fed into that, and I apologize that I'm not a Python developer. We process those and then display the results back to the user. All of that is done server-side in AWS. Well, serverless. Mm-hmm. Sure. Are you military? So I went to AUSA earlier last year. Oh, sorry. How this technology would be related or used in the military, essentially, to summarize. Is that what you asked?
No, I said potential applications for medics. For the military,
That as well.
battlefield, injuries, things like that.
Yep. So potential applications with the military and use cases, medics, et cetera, out in the battlefield. I went to AUSA, so it's the Army's conference last year. I pitched this company to board directors. We are working with MRMC at the moment to better understand and deploy this technology with them in conjunction to the military. Right now, their best use case is concussions, mild traumatic brain injury. It results in a lot of pulls of military personnel or non-optimal personnel that are operating in the battlefield, so that's the biggest pain point for them. They are interested in other aspects of the technology like threat detection and toxin detection is one thing that we can do with the tech.
So we hear a lot about high school sports accidents with football and head injuries. Is this something where time to detection would help prevent possible deaths from such high school activities?
Yeah, so when we talk about deaths, they're rather uncommon. But one thing that we do need to remember and understand is that concussions are not a one-hit problem. They're a cumulative issue. So if I have a large hit and I'm not displaying any symptoms, then if I go back out there and get hit again, then I may start, but by then it's a big issue. So in that aspect, with it being a rapid 5-second test, that helps with the time to detect by a substantial amount and will allow us to monitor progress on the field. With the 84% undiagnosed rate, we can see that that is not a need that's met yet.
So you guys apply to the sports technology incubator?
Yeah, the one that's hosted by, I think, there's one hosted by Heritage and then there's another one. I don't know if that's the one hosted by Heritage. Yeah, so we've already been through an accelerator program. We're considering, others, but it's not needed or necessary. Now, we are a venture-backed company, not a lot, but we are a little bit. So, Elevate Ventures and Ocean Capital.
Does this count as a medical device? Do you have to finance
Can you repeat the question?
Yeah, so
is any changes or force
so the question was, is this a medical device? The answer is yes, it is a 510K exempt device with the FDA. Quality system control, implemented, integrated. We are registered with the FDA for this technology that is, from a maneuverability standpoint, superior with us because other companies that try to do the same thing not so much. Now, that's for the base technology. The concussion, the one that will suggest that there's an issue in the concussion space, that one is a class 3 device that will require PMA. We are currently undergoing a clinical study with IU Health at the moment.
What can the folks here do to help you out apart from voting for you?
Well, apart from voting for us, which you should, but apart from voting for us, since we are launching next week, any sort of communication interaction with medical professionals that operate in the space that could utilize pupillary light reflex technology to help better their workflow. A lot of physicians are already utilizing it. They're not utilizing it at its full capacity. And we offer a robust and resilient system to allow them to do that. So any sort of networking would be appreciated. We've tried demoing the product by walking around with a baseball bat. Not good reception. So.
I found out, if I missed this, is this only for medical professionals, or is this something like a dad's club coach could have on the sideline where there's not that trainer at the complex?
You are talking about the vision of the company. So the question is this something that a doctor can only use, or is it something that you could download and utilize? Right now, a physician, since it is a Class 1 510K exempt product, a physician is the only one that can utilize it. Well, a physician or medically trained personnel. Our goal and mindset is to get this to a point to where you can download it and use it for your children, your friend. We've already established a clear pathway with Med Institute, a spinoff of Cook Pharmica, to be able to do this. So we know the steps we need to take, and we are actively working towards those today.